बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक वसल्लम अलैहि. Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is male 50-year-old patient. He is non-diabetic, that is uncontrolled. He is also having diabetic foot. Now for the last 5-4 days he is giving history of vomiting, indigestion, decreased appetite and mild pain at the epigastric region. So this is the epigastric region. We can appreciate stomach filled with the fluid, and this is the pancreas. And now I'm going to scan the liver and the gallbladder. Here we can appreciate the gallbladder, and this is the liver. Here we can appreciate the increased echogenicity of the portal triad, and however liver is normal in echo texture. No heterogeneity or irregular surface is noted. And here we can appreciate the gallbladder, which is distended with bile, and we can appreciate innumerable echogenic foci that are showing comet tail artifacts. So innumerable foci are present within the lumen of gallbladder, and these are freely floating. There is mild thickening of the gallbladder wall. However, we can't appreciate any stone within the lumen. Now I'm going to scan it with a linear high frequency probe to have better visualization. So here we can appreciate this is the gallbladder, and this is the wall thickness, which is not too much increased. Only the findings is these comet tail artifacts that are freely floating within the distended bile-filled gallbladder. And if we closely observe, this comet tail artifact is at the periphery, but it is not arising from the wall. So no wall calcification is seen, no significant thickening of the significant thickening of the wall is noted. However, the finding is the gallbladder is distended. Gallbladder is distended with bile and is showing multiple echogenic foci that are showing comet tail artifacts. We can appreciate the comet tail artifacts. Look at here, this is too much Again, I am using the high low frequency probe. Here we can, and other appreciate we can multiple comma tail artifacts. So when echogenic foci with comma tail artifacts are present, it means that air is present within the lumen of the gallbladder. When the air is present within the lumen of the gallbladder, that is distended with bile, having mildly wall thickening in a non-diabetic patient, it is likely the case of emphysematous, emphysematous, emphysematous cholecystitis. So, likely, in my opinion, it is the case of emphysematous cholecystitis. It can be porcelain gallbladder, but there should be wall calcification which is absent, and also sludge may be seen, but sludge gives the layering. A layering of the sludge is seen, so it is not a sludge. And also so we can say that also the adenomyomatosis is another differential, but there will be wall thickening and the wall calcification should be present, and that calcification can give the comma tail artifact, but it should be present in the wall. That is not here in this case. So the most likely, in my opinion, the diagnosis is emphysematous cholecystitis. So here this type of pathology is seen is having such a sonographic picture. Thank you very much.